This video is going to cover GuidedSMILE's Chrome Natural, which is an FP1 design of the prosthesis, which entails a crown and bridge prosthesis. It entails a little bit deeper implants. It is about saving bone, not flattening bone. It's a wonderful product that we've been developing over the years. So let's go through this case. This is a patient in Ireland completed by Dr. Hamill, and it's really a lovely case, a wonderful job done by Dr. Hamill. He completed a smile simulation by preview, give the patient an idea of what the smile is going to look like. They do really a wonderful job. This preview company, you can see on the bottom right, that's the company. And the doctor had a little bit of a challenge with the bite. Right, this the flipper, the partial that the patient had was not at the right vertical, and it covered quite a bit of the palate. It's very difficult to cross mount the case, even though there is a molar in the back. We really wanted to make sure that we had the bite nailed. So doctor had the JC try-ins made, and this was a while ago. This is back when we did more dual scans with the JC try-in, but lately it's been just seat, make sure they don't rock, they fit just like a flipper, and then equilibrate and take a physical bite. But sometimes if it's covering a lot of tissue and the patient may only have one tooth, two teeth, can't tripod, then a dual scan can be very helpful as well. In this case, there was a dual scan. But the JC try-ins, this is what you would do in the appointment: equilibrate until they seat, and adjust until they seat, and then equilibrate, and then take a physical bite. And the only critique you probably hear is just take a bite on the left and the right, and leave the anterior without bite material, so you can see how the teeth are coming together. Make sure the patient is biting the same way every time. You can see even here the patient's biting differently in just the two photographs. All right, so we want to make sure that the upper and lower are aligned perfectly, since we went through all this work to idealize the bite. And with that, we got the case ready, met doctor online, planned the implants, planned the positions, everything, and sent the case off to surgery. This will be a Straumann case. This was the older GM system. And the SurgiMat, which I think everybody's familiar with, is put on the wall, and this gives the instructions, basically instructions from left to right, which is pins, bone reduction, osteotomy guide, and here actually we moved this to the left lately, but that's the scalloping for adjusting bone, and then all of the drilling sequence from the Straumann system for all the tools and everything. And then here, this is the mat part that goes on the counter. So you place your implants, your abutments, and your TEP cylinders on the counter for a grab and go, as we say, nice and organized. So this is an FP1, and so it still has, as all cases, it has a pin guide, and this pin guide is going to be partially tissue supported, and then a tooth here and a tooth there. All right, so have some care with the pin guide. You don't want to push too much over here and compress it. So it's pretty much even pressure throughout. Maybe a little additional pressure where the teeth are. And the tissue is reflected apically to the fixation base. The fixation base is then inserted with the pin guide as per normal, and then follow the drilling with the long and short pins as indicated on the SurgiMat right there. Looks a little bit different these days, but the same idea is that this is where you have instructions on which pins to place, which drills to use. Once the fixation base is secure, it is removed, and then in this case, because it's FP1, then the teeth are extracted, and then the doctor will use, in this, it's different ways to approach this. In this case, the doctor actually used our scallop guide, ordered the scallop guide. Now, this is a full wrap. Don't make too many of the full wraps anymore. Mostly it's a labial scallop guide only, so you can visually look at the patient straight on and see where the bone needs to be augmented, adjusted. The nice thing about the full wrap in a case like this is that the patient doesn't have any sockets. They've been edentulous for a long time. So this socketing back here gives you the rounded viewpoint of the teeth, where the necks of the teeth are, where the implants are going to be. And this could help you from an occlusal view of where you might want to put divots for pontics, and where you may want to open up that area for emergence for the multi-unit abutments. Of course, that'll be some of that will be from profiling as well, but it just really gives you a nice orientation of the plan for however you'd like to augment the bone. All right, and then when you're happy with that, and some of that can be trying the prosthesis in as well, as we've shown in other FP1 videos. You can do a combination of the scallop guide and the prosthesis, and that way you see exactly where the necks of the teeth are, and use that to adjust the bone. Right? And once you're happy with the bone, then you'll seat the osteotomy guide. You'll use the part of the surgery mat that gives you the instructions on the drilling sequence. You can also have a look at the osteotomy guide on the surgery mat. This helps just identify everything's in the proper position. Sometimes these sleeves look a little bit labial, look a little bit lingual because of trajectory and positioning, that type of thing. But as long as the fixation base looks like it's in the right spot according to the other image on the surgery mat, then the osteotomy guide is going to be in the right place. Fortunately, you have a nice visualization window here to watch your drills go through their sequencing as opposed to plastic guides. All right, so a little bit of adjustment here, got it seated. And then, all right, so go through the whole sequencing, place the implants. They have been planned subcrestally, place the multi-unit abutments. Seems to be that's vast majority, high percentages using multi-unit abutments in these cases, not direct to implant. So multi-units, 10 cylinders, you can see some of these were pre-cut. Okay, and there's different techniques of how you would pre-cut those for each site. It's very handy to have so that you can have a prosthesis that has resin at the occlusal instead of metal. I'll show you this at the end. 10 cylinders are in, gaskets are down, prosthesis in, locked into the chrome locks, and the plugs are placed. And then inject stellar tooth color material, light cure, and remove. And this is where I was saying, see how deep those temp cylinders are? It's just easy to make this very, very nice looking instead of the metal. Now, these might have been a little bit shallow, so instead he adjusted these outside the mouth. But these look nice, like almost like small holes, right? Almost like small hole technology. All right, so while the tech or the assistant is back in the lab doing this work, doctor has sutured, put some healing caps on, did not load all the implants, as you can see, buried a couple. And then came back and delivered. Very nice work. Really, really nice. So that is a chrome GuidedSMILE FP1 natural case.